Welcome to Riverside Talk. My name is Denise Mananas. I'm the Associate Vice President of External Affairs at St. John's Riverside Hospital. Today we are very excited to speak with Dr. Sophia Lubin about a topic that is often not spoken about openly, and that's menopause. We have a lot to cover, but before we dive in, I would like to acknowledge the team that does put all of these programs together. They are Nancy Anabi, Candace Cousins-Hopkins, Olivia Hunter, and Jason Latorre. And also, I would like to acknowledge our original partners who have helped us put these educational programs out for the community. They are Yonkers Neighborhood Naturally Occurring Retirement Community, that's quite a mouthful, and the Yonkers Public Library. And also our new partners in the community that help us get the word out about these programs. The Ashling Irish Community and Cultural Center, the Department of Veterans Services City of Yonkers, Ardsley Senior Center, Bronxville Community Center, the City of Yonkers, Community Baptist Church, Greenberg Parks and Recreation, Hastings Community Center, Irvington Community Center, Westchester Jewish Community Services, and Yonkers Pathway to Success. And now I would like to take a moment and introduce our speaker today, Dr. Sophia Lubin. Dr. Lubin is a board-certified OBGYN that has been practicing medicine for over 15 years. I can't believe that. I really can't. You look so young. She currently practices at Symphony Medical, where she provides a wide range of services, including routine obstetrical and gynecologic care, as well as surgical interventions. She is also the medical director at My Wellness Solutions in Harlem. Dr. Sophia holds a BS in biology from the City College of New York and obtained her medical degree from NYIT, New York College of Osteopathic Medicine. She completed her OBGYN residency training at Beth Israel Medical Center in Manhattan, which is now Mount Sinai, Beth Israel. Whether it's sharing knowledge about through her Dr. Sophia OBGYN podcast, educating medical students, or doing humanitarian work abroad, Dr. Lubin continues to broaden her practice to help women lead happy, healthy, and empowered lives. And so welcome to our program today.
Thank you. Thank you so much for having me.
Well, so why don't we just dive right in?
Let's dive right in.
All right. So menopause, it's a word everybody knows, but probably people don't really know all that much about what it really is. So can you give us a little bit of a overview? What is menopause?
Well, we can start just with a definition. When we think about menopause is when a woman has stopped getting her period for a total of 12 consecutive months.
Okay.
And she's at least age 40.
Oh, so if you stop getting your period prior to the age of 40, that's a signal that you should probably go to the doctor and check that out.
Yes. And even if you get it at age 40, it's still a signal to go and check it out.
Okay.
But definitely, if a woman stops getting her period for 12 consecutive months, she's not pregnant.
Right.
And nothing else has happened, but she doesn't see her period anymore.
Okay.
Then yes, if she has that happen to her before the age of 40, then that is too soon.
Yeah.
And could be something completely different going on.
All right. But even 40 sounds so young to me.
Yes, it does.
Right?
Yes,
so,
it does.
I know that there is sort of a process of menopause.
Yes.
So can we talk about that?
Yes. So when I say that if a woman goes through menopause at the age of 40, no one's necessarily going to bat an eye per se, but the average age of menopause is 51.
Oh, that makes sense.
Yes.
Okay.
And so a woman who does go through menopause at age 40 is going through menopause earlier, a little bit on the younger side for sure. When we think that the average age is 51 and it can be as late as 58.
Oh.
Right.
That sounds terrible.
So it's bad on either end, right?
Yes.
But
all right. So perimenopause has a sort of bookends. You start having. Tell me about perimenopause. When things start to happen, what are you looking for? What are the symptoms?
So menopause itself, the word is really talking about the sensation of the period. Okay. But it just doesn't encompass all the things that's happening and that transition period before you get to that last period. So that transition period is that perimenopause phase.
Okay.
During that transition, though, you are experiencing some of the symptoms, and there are like over 50 plus symptoms.
50 plus symptoms?
That's what I said.
That does explain so much. Okay.
50 plus symptoms that can be occurring during the time of both perimenopause and menopause. And the thing that really we should take into account is the fact that once we've hit menopause, meaning your period stops, you're in menopause for the rest of your life.
Okay. Do symptoms stop when your period stops finally?
So when your period finally stops doesn't mean your symptoms stop. If anything, for some women, those symptoms really get exacerbated and can be worse. They can be the same. You can get some of the symptoms, some of them go away. You can have a mixed bag, and that mixed bag can last you forever.
Let's talk about the symptoms. So let's say you're in your mid-40s, just as an average, what are you noticing?
The first sign usually is a change in your period.
Okay.
So we're not getting our periods regularly.
Okay.
Okay. Or they start to have real changes, like they're coming shorter in terms of a cycle. So you may see your period happening twice in a month, or it's taking 2 or 3 months to come. You may also notice that the duration of the period may change, meaning instead of being a 5-day period, it can become shorter and become a 2 or a 3-day period, or it can become longer and just be this extended period.
Well, it all sounds terrible.
It is.
Okay.
But that's like just the hallmark, like that's just like one of the signs.
Okay.
But some women can start to experience, with a very regular period, they can still start to experience things like hot flashes. They can start to experience moodiness or irritability or just new challenges when it comes to their mental health, feeling more panicked or anxiety, being able to not feel focused,
Right.
Scatterbrained, or like what we call ADHD symptoms.
Or fog. Brain
Mental
fog.
fog,
Yeah.
for sure, where they feel like they just are drawing at straws, trying to figure out what's their next word. Or when they're at work or even at home or with friends, that they just don't feel as sharp.
Interesting. Is there any genetic component? Like if you saw, and I did watch my mother go through menopause and she had certain symptoms, is it likely that I would experience something similar to her? Or is it wildly different and not necessarily genetically predisposed to a certain set of something?
I certainly believe that there is some, let's say, genetic component, or at least what we call multifactorial, right? That if you and your mom, you consider yourself like you all grew up in the same area, ate the same diet, had the same food, had the same lifestyle, that certain things may be the same.
Okay.
You know, so more than just, oh, well, my mom went through menopause at 48, I'm definitely going to go through menopause at 48.
Or even experience certain symptoms. Okay. So it's not necessarily, there have to be a lot of other factors that are similar to begin to really understand if you're going to have a similar experience.
There's definitely one thing we should all understand is that lifestyle plays a role.
Okay.
And so in terms of how women experience their menopausal symptoms.
Interesting.
Outside of that, but also when they experience menopausal symptoms as well. So some women experience menopause on average at an earlier time versus some women who is always later, you know,
Right.
like certain ethnic groups, for example, or women, for example, who are smokers tend to go through menopause earlier.
Interesting.
Yeah.
Is there any correlation between if you get your period when you start your period as a young teenager at, let's say, 12 or 11, there's some young girls are getting it earlier and earlier, I understand,
Yep.
that you would go through menopause earlier based on that?
No, not necessarily.
So it doesn't really...
That part
okay.
doesn't correlate.
Okay.
Not that, I started my
Interesting.
period at 9, and so therefore I'm going to be done with this by the time I'm 42.
Yeah,
no.
no. Okay. Well, that's too bad.
Yeah.
All right. So a lot of these symptoms sort of mimic other symptoms from other conditions.
Definitely.
So how if you're in your mid 40s, or let's say you're 44, and things start to kind of change, but you're not exactly sure what's happening, how do you know it's that versus
Something
something
else.
else?
So that's a great question, because most women who are experiencing perimenopause symptoms on average will see probably about 5 doctors before they actually get to the doctor who kind of puts the picture all together
Oh.
and says, hey, I actually think you may be experiencing perimenopause, because the woman may experience fatigue, she may be experiencing new headaches, she may be experiencing the mental fog, she may be
Right.
experiencing the moodiness, or some mental health changes. She may be experiencing night sweats or not sleeping. And so she may have things like a frozen shoulder or just new joint pains. And so she'll see a rheumatologist, an orthopedist, she'll go to a neurologist, and everybody for those individual symptoms that she's experiencing. Whereas what's really happening is that she's having major fluctuations in her hormones.
Right.
Because what's really going on in perimenopause is that instead of everything kind of being on this gentle cycle that we go through,
Right.
it's kind of like
All over the place.
everywhere.
So 1 month it could be normal, the next month it could be
That
totally
is
out of
correct.
whack.
Out of whack.
Out of whack.
That is
That's
correct.
wonderful. So most women, as you said, average age 51, ceasing the having
Period.
their period. But in perimenopause, in your 40s, and you're having some of these symptoms, there are treatments, one of which is hormone replacement therapy.
Yes.
But there are other things. So let's start with hormone replacement therapy, and tell me what is new, current, or not new and current about it. And then we'll talk a little bit more about its safety and other things.
Sure. So hormone replacement, let's actually start with a menopausal woman, a woman who's gone through the full 12 months of no period, because
Okay.
that's really the easiest person when we talk about hormone replacement to replace.
Yes, 'cause
because
there's
they
nothing
stop.
there.
Right.
Yes.
Exactly. It's stopped. And the best time for a woman to start hormone replacement is early in her menopause.
Okay.
Meaning while she's going through the transition, and certainly after she's gone through it.
So not necessarily the first time the first couple of months that maybe things were a little different, or you maybe had an interesting evening of sweating all night. But once you really see an established pattern, you might want to have the conversation.
It's very easy for us to both check, like labs to know that you really are in menopause. You've gone through the 12 months of no period, and you're having symptoms that we know are attributed to the lack of hormones. That drop, and it's a consistent and persistent drop in hormones.
Okay.
So, and the hormones we're talking about, for the sake of this conversation, let's say estrogen.
Right.
Estrogen being the hormone, the feel-good hormone for women,
Mm-hmm.
And in all honesty, estrogen has over 400 functions in the body.
Wow.
Right. So if we lose it, you can imagine that those 400 functions are not going to be
Becoming
happening.
clear all of a sudden. That's incredible. 400 function.
Yeah, including our skin.
Yeah.
Right. So it's like, if you remember, you see someone 1 year, and then you see them maybe 2 or 3 years after they've gotten into their menopause, you may say, wow, that woman looks like she's really aged. She's only 2 or 3 years out, but because her skin has also changed.
Right.
The elasticity of her skin has changed. So with menopause comes all these changes that are happening in your body. And so the concept of hormone replacement is really just to kind of coast you back to where you were, right, before that
Right.
change. And so just kind of imagine, and I'm sure a lot of people would feel this way, it's like, if I am going to take something away, or something that I need, or something that was doing so much for me, I take it away and I end up with all these symptoms. Well, if I put it back at least a little bit,
Mm-hmm.
then I get to still feel like myself, That's how I like to consider hormone replacement.
Okay, so hormone replacement therapy, though, has kind of gotten a bad rap.
Definitely.
Because, and I don't know if it's changed over the years, there are a lot of people, there's been a lot of press, people feel very afraid of it because there is an association with developing cancer of a variety of types, particularly breast cancer, but I probably think other cancers. Is there any truth to that?
So here's how I like to explain that particular point. The thing is that there was a specific study that was done like 20 plus years ago. That study was actually looking to see how hormone replacement could actually benefit women and do all this preventative stuff that hormones do in the first place. It prevents women from having heart disease, for example. And so that particular study, though, the average age of the woman in the study was in her 60s.
Oh, so long past
Yes.
the ideal time to start.
That is correct.
Okay.
Exactly. And so some of those associations, sometimes for me, it's hard to make those associations because that woman would have already had an increased risk of all those things.
Okay.
And so sometimes it's hard. Now, the other issue is that when they did the study, they, made these links and connections, let's say, to things like a breast cancer.
Right.
Which, how would I make it so it's very simple? Imagine that you have a group of women, and out of that group of women, there's going to be a subset of women that's going to develop breast cancer anyway.
Right.
Right? And so let's say that's 4 women. And now we have this group of women and we put them on hormone replacement. And now we've gone from 4 women to 5 women. Okay? We haven't made such a big jump.
Right.
You know what I mean?
So are you able to draw the conclusion that it's the replacement therapy, the hormone that has caused it, or these women were going to get it anyway and that 5th one was just an anomaly?
It's totally possible.
Okay.
And even if still, if we're talking about, let's say, out of 100 women, we went from 4 to 5, did we really, is this a real all-cause, relationship?
Right.
When we're talking about that? And going from 4 to 5, it seems like we've gone up by 20%, but did we really, if we went from 4 to 5 in a group of 100?
Yeah.
So the way that the analysis of the
correlation,
those types of correlations that were made in that study, I think were very much kind of inflated in a way that kind of
feels like it's so fixed in our consciousness. It's in the media. People have taken that.
Well, things go
really.
The problem is that in the media, that's exactly what it is.
Yeah.
Right. So they latch on to things.
Yeah, and everyone believes
give
this.
it. Well, it's not just that. It's just that they kind of hone in on this one thing
and
they inflate this one piece,
Yeah.
as opposed to seeing all the benefit. In the same study, they saw without a shadow of a doubt that there was a reduction in colon cancer, for example.
Oh, that's pretty nice.
Which is really nice.
Yeah, that's good.
Yeah. And when we think about it too, the other thing is, especially when it comes to breast, and I'm not taking anything away from the harms and the seriousness of breast cancer. But if we just compare how women change after menopause, and one of the number one killers of women being heart disease, okay, where they go from having a risk of 1 in 7 to 1 in 3 once they've gone through menopause, which we can correlate right back to the fact of their
depressed here, doctor.
No, don't get depressed. Feel encouraged. Don't get depressed. Here's what I'm saying. If we were looking at the number one killer of women, which is heart disease,
right,
and the way that your body changes after you go through menopause, which we can 100% correlate to your hormones.
Right.
Okay. And let's take that and compare it to 1 in 8 women who will develop breast cancer. Okay. We went from 1 in 7 or 8 in terms of when they're younger women to 1 in 3.
Yeah.
After menopause for your heart.
So this is balancing risk, is what
it's about balancing your risk.
So all right, but here's another thing. If if a woman is looking at this, let's add something to the risk discussion. My mother did hormone replacement therapy. She had breast cancer.
Okay.
So when I was embarking on menopause,
Yes.
they went, no,
We're
not
definitely
putting
not
you,
doing
we're not
that,
doing
right?
that for you. So I kind of went through that, but you said, and that will bring us to another part of this conversation, which is what are the other treatments for menopause? What else is out there? Because I think a lot of women think it's that
Or nothing.
or nothing.
Yeah.
Because for me, it was nothing.
Right. And so I think the major problem is that we didn't recognize how much lifestyle, diet, nutrition, exercise, and things like that also affect some of the symptoms. Women on average who exercise daily, moving your body, getting enough things like vitamin D, tend to have less symptoms.
Okay.
Okay. And so the importance of those little tweaks that we can do on our everyday in order to help with mental health changes that are happening during
Right.
menopause. There's also things like there are some natural remedies: evening primrose oil, black cohosh, ashwagandha, magnesium to help women with sleep and just some focus. So there are some natural remedies out there. And there's another big thing we didn't talk about at all, which are what we call the genitourinary symptoms of menopause.
Oh, that
Okay.
sounds terrible too. Tell me what it is. Tell me what it is.
Oh, well, I hate to be the bearer of all this bad news,
No, but
I don't want it to seem that
No,
way.
but you know what? I think that being informed is, I'm kind of being funny about this, but I think being informed, certainly I would have something to look for that I would recognize if you tell me what those are, and that, what are those treatments for those things, because I know that you all have a great big bag of tricks.
You got
but
that
I think
right.
people in our community, they just don't know what's available to them or what they can do to for self-help and self-care.
I agree with you 100%.
Yeah.
So genital urinary symptoms or syndrome of menopause is when we think about painful sex, for example, because of atrophy, recurrent urinary tract infections because of the changes that have happened at the level of the genitals.
Okay.
Like I said, imagine all your skin is changing. That includes genital skin.
Right.
Okay. And becoming drier, less elastic. And so just imagine if that's happening at that time, then you can have just pain, discomfort, makes it that you will have these recurrent urinary tract infections. And so the best option for those women is vaginal estrogen.
Okay.
And that almost all women probably can take because there's such a small amount of the estrogen that's even what we call systemically absorbed, meaning going through your whole body.
Right.
It's really working locally right where you need it.
Interesting.
Yeah.
Okay. So, all right, let's go back to hormone replacement therapy. You talked a little bit about the other kinds of things. Those are all natural kinds of supplements and herbal things. Where and how do you know what to buy, the efficacy of those, whether or not they're, you're getting the right stuff in the right dosage? And I think a lot of women, and particularly now, if you go online, if you're on TikTok or Instagram or any of these platforms, you're inundated. If
Yes.
you look at one thing, you are forever going to get the ads for everything in that line. So
I think this is where, because of the advent of social media and certainly with apps and things like that, I do think it's good to go to reputable sources. So a handful of those, I would say, there's an app called Balance. There's an app called Perry, Perry. And I think you can get really good information right there.
Okay.
And
So
it's really a
supplement
community.
too, and give you an idea.
Yeah, it gives you an idea
Yeah.
of what are some of the things you can use. It's a community, Perry, for example, is really a community around women experiencing and going through perimenopause and menopause.
Speaking of these apps and all of these ads that we're inundated with, the whole weight loss, GLP
One.
craze, the GLP-1s that are out there, aside from taking the shots that everybody started with, there's an awful lot of that. Now, weight gain is definitely a thing.
It's a major part of
and I know
menopause and
women-
perimenopause.
I know women every day are going, well, maybe I should do that, but they're beginning to not make it as accessible to get those shots for weight loss, because originally I guess those were for diabetics. But so now there's all kinds of supplements and things. How do you feel about those kinds of supplements for women?
I think that because weight gain is a component of some of the symptoms that a woman will experience during menopause or perimenopause. When a woman goes from saying, I was a dancer my whole life, I kept my weight, I was 140 pounds my whole life, and now all of a sudden I've put on 10 pounds. No matter what I do, I'm eating well, I'm still exercising every day, and instead of losing, I'm continuing to gain.
Wow.
And not only would that woman continue to gain, oftentimes they're gaining weight in areas of their body that they never had weight before,
right,
like their abdomen, and so they tend to feel it really, on top of the other, like moodiness, irritability, things that are changing,
feel out of control.
Like mentally,
yeah,
it just really can put you down.
It does put you down. I know
Yeah.
a lot of my peers are in that place where, what I don't have any control over my own body anymore.
It certainly feels like you have no control. And I think that if losing weight in a very structured way, so under physician guidance, and if that includes taking a GLP-1, I think that it's worth it, because for some women, it really helps to bring back that mental confidence,
That's very, very interesting. Okay, so medically induced menopause. I just want to change topics for a second.
Okay.
Why would someone need to go through something called medically induced menopause?
So first, let's think about what it is, or what does that mean? So that means that they have undergone perhaps some type of a surgical procedure that has removed their ovaries, or that they've taken some type of medication or something that would essentially stop their ovarian function. And so we just need to think about what are some diseases or things like that may cause that.
Right.
And the first that comes to mind really is something like cancer of the uterus or of the ovaries themselves, in which case those organs would be removed.
And then the
Yes.
production of the hormone would stop.
That is correct.
Okay, but there would be no other reason to induce a medical menopause.
The other subset of people that I would consider would be women who are at severely high risk of developing those type of cancers.
Okay, so they have a genetic.
They have a genetic
Got it.
reason for developing those type of cancers. And so again, in order to take away that risk, you may have to remove those organs. And so therefore they would be under the medically induced menopause.
Okay, so I want to switch back for a second. We talked a lot about, and we started to talk about the supplements and the other things that women can do, but what are the lifestyle changes that women could maybe start implementing in their own life to help manage their symptoms? Because I do know from my own experience and from the experience of my peers, symptoms are wildly different.
Yes.
And what might work for me is not necessarily going to work for somebody else. So what's possible? What should women be doing to manage this?
So first thing, acknowledging what's happening in the first place.
Okay,
Let's just start there.
Yeah.
Right? Is to understand that what's happening in their body, no, they're not going crazy. It's true. It's real. It's really happening. Today you're hot, tomorrow you're not. Today you can't sleep, tomorrow you can't. Today you're really, really moody, tomorrow you're so apologetic. Those are all real. And so if you are able to have a little bit more grace with yourself.
Oh, that's an interesting thought.
And what I mean when I say that is, okay, I don't know if I'm going to be hot or cold today. Let me just take a jacket with me.
So common sense kinds of things.
It feels like common sense, but the problem is that in the moment,
you don't realize it's happening.
Exactly. And it can happen in an instant.
Yeah.
Right? Like something like a hot flash, which literally feels like a heat that starts in the middle of your chest and goes up. You can see the smoke almost sometimes coming out of your head, right?
Wow.
And then you're left with this cold flush afterwards. And so you went from wanting to pull all your clothes off to then looking for a jacket or a shawl or a sweater or tell people to turn off the AC, you know? And so it's understanding that those things and those changes can be happening in the first place. So that way you don't get so irritated or annoyed or frustrated with it.
So you begin to plan for the management.
Exactly.
Okay.
Okay. And then other things. Maybe it's not having a glass of wine with dinner because alcohol can, further exacerbate hot flashes, for example.
Or sleep
night
disturbances.
sweats. And the sleep disturbance, exactly. So it's like managing. It's like saying, okay, is it worth it for me? You know what? It's my friend's 50th birthday. Is it worth it for me to have a celebratory glass of champagne with her and know that when I get home tonight, I might not sleep?
Yeah.
And it's making those kinds of, if you know it in advance, it's making those kinds of decisions.
So there is a component of self-awareness
Yes.
that is required. And I don't, from my own experience, I don't think that women in our society and our cultures put themselves first enough to focus on that. There's family, husband, home, children, work.
Yeah, you're last.
Parents, whatever.
Yeah.
And so being last, it's okay, I'm just not going to pay attention to this right now. But I guess putting habits into play so that you don't have to think about them. So let's go back to, those are very interesting, sort of focus on yourself, plan for, you're going to be hot, you're going to be cold. But thinking about diet, thinking about alcohol, what about exercise and the amount of exercise?
So exercise is super key in this particular part of your life. I mean, I like to stress exercise no matter who it is who walks in the door. I don't care if you're pregnant. I don't care if you're only 15. I don't care if you're 25. But certainly at 45, we need to know that exercise is a part of our lives.
Right.
Like full stop.
Interesting.
And what does that look like? It looks like doing both strength training and cardio.
Oh.
Okay, so it's not just going to an aerobics class
Or just walking.
Although just walking is very, very good for you,
Okay.
but it's just not enough. Because at the end of the day, we still need to do the walking and the cardio.
So
right?
if you were walking and you put the weighted vest or the
Yeah.
on your arms or
Yes.
even on your ankles,
Ankles.
does that cover you in
Yes.
all things? So it's not just walking, but you're getting the benefits of a little bit more of a workout.
Exactly. So maybe what you can do is you can put the ankle weights, and then when you're doing your walk, you do short sprints, perhaps, or you just lift your legs up higher with your walk,
Right.
in order to kind of work on those really big muscle groups
And give yourself a little bit of cardio.
and definitely give yourself the cardio, because at the end of the day, I just said, this is when women tend to experience cardiovascular disease. Their risk increases.
Right.
So if we're paying attention to that, that's why you need both.
Okay.
But the strength training, what's happening there is that our metabolism is changing dramatically during this time.
that dreaded M word too.
Yeah.
It's another dreaded M word, metabolism.
I know.
It's terrible.
I know.
So, I mean, we're inundated and we talked about this, but the metabolism boosters, I mean, is all of that nonsense, that all of the stuff that we're being inundated and being sold, and is there such a thing that you can help your metabolism, help your skin? Are there supplements that you would recommend if someone came in with a laundry list?
I would say my top maybe 4. I think everyone probably needs more vitamin D no matter who they are.
Yeah.
I mean, we live in, especially here, we are in New York, very close to New York City, and we're surrounded by buildings, and we don't get outside enough, and we definitely don't get enough sunlight. And even if we do, it's still not enough.
Okay.
So we
So
probably
you need to supplement the D.
you need to supplement with vitamin D. I would say that magnesium is probably another. Magnesium is an easy supplement that can help with just muscle relaxation. It can help with calm. It can help with nerves. It can help with GI, stomach issues.
There are multiple forms of magnesium.
They are multiple forms of magnesium.
What are
and
the
so
better ones?
like a cocktail even of
Okay.
magnesium,
All right.
so if you can find one that has both magnesium, glycinate, exactly.
And there's a couple of them.
Yeah, there are.
Yeah,
Yes, exactly. But the point here being that, yes, you need a little bit of a combination of them, but it's helpful. Vitamin C, because at the end of the day, as our immune system goes down when you are losing your hormones. And so you always want to still be boosting your immune system.
Yeah.
And so things like, and then this one is kind of supplement, but also with food, is probiotics and prebiotics. You want to help your gut.
Okay. And so there also goes to the nutrition and the food and the choices that we're making.
Yes.
All right. So we've talked a lot about metabolism and weight and food and supplements. Hormone replacement therapy, though, as a pharmaceutical answer, are there natural supplements that sort of mimic the hormone replacement therapy that you would recommend? Because there's still going to be a lot of doubters and naysayers as I don't want to do that, or I can't do that because there's breast cancer in my family, or whatever. What can they do to begin to replace some of that hormone?
So again, I would just go to nutrition and exercise to start. I always say start with lifestyle, number one. For things such as vaginal dryness and things like that, you can look through natural remedies such as coconut oil. You can also get things that have like a combination of a hyaluronic acid in it as a suppository in order to help with that aspect of it. And then when we talk about there is no direct correlation for me with estrogen.
Right.
You know what I mean?
It's that or nothing. I get it.
I hate to say that or nothing. It's just,
you can't mimic
you
nature.
just can't. Yeah, it's just not the same.
Yeah. Okay.
It's just not the same.
Okay. That's fair. So now I want to go back and talk about the mental emotional health and both recognizing what those things might look like and then what women can do for those things.
So I think, again, I would say that the first thing is to recognize that you're not out of your mind. Again, so that the woman, it's true, because
It's true.
like I said, women on average will go to 5 different doctors. A psychiatrist is one of them.
Wow.
Right? And it'll be the first time they are ever diagnosed with a mental health issue, whether that's anxiety, depression, ADHD, etc.
So being diagnosed with anxiety or any of those other things, because I swear I have ADHD now, but being diagnosed, there are pharmaceutical recommendations for those. Do you not recommend those until you kind of circle back around and figure out this?
Yes.
Okay.
Yes. Now, granted, someone who's having an acute crisis and who definitely needs psychiatric help and needs help immediately. And immediately, I mean, when we start an antidepressant, we still won't see the results, probably not another 2 weeks.
Right.
But so not to take anything away from that and the use of those kinds of pharmacologics.
Absolutely.
But I definitely think that we don't take into account how much menopause and perimenopause can affect mental health, and that if we address that we actually can be addressing their mental health situation.
So, okay. For women choosing to know which doctor to go to when they start seeing changes, that's key.
Yes.
Right? And getting the help they need. But if there is a serious psychological or psychiatric issue, acute issue going on, they should absolutely seek out help and not be
100%.
afraid to do that. Okay.
Yes.
All right. So let's say I'm 40, let's go back to when women go to the OBGYN. That's a very basic beginning. Most women start with an OBGYN because they want to get pregnant.
Yes.
They are going to have a family.
Yes.
And so they know they need to have a baseline and they need to be checked out. And then they know that they're choosing someone who's going to deliver their babies. The relationship that you then develop with your patients post children, a lot of women get very busy and then they stop going and getting those appointments in. When should women come back to the doctor? When should they start doing mammos? When should they start having things checked out so that there's a rapport and a conversation that's ongoing?
That's a great question. I like to consider the doctor-patient relationship. And that relationship starts from the first time you see them. And so I think it makes sense that a woman, even if she's done with her childbearing, for example, to understand that that relationship still stands. And so if you're in that relationship, then having at least on an annual basis, check-in with your doctor. And not just on an annual basis, but it's also, it should kind of be a check-in with yourself, because it's like, hey, what's going on with me that I need to make sure I address with my doctor?
Right.
And I think a lot of us, because of what you said before, we wear so many hats. We're doing so many things, and especially women in midlife, they're really sandwiched. They're sandwiched with their teenage and young adult children, and then they're sandwiched with their elderly parents, and then they're sandwiched with the fact that they're usually the most experienced person on the job. Right? So they're being pulled in these different directions, and so oftentimes they are the ones who are last. And so it's really a mindset shift that needs to happen with women, and understanding that, definitely creating that kind of relationship with their doctor, and coming to that relationship really armed with information about themselves. So, and not taking no for an answer.
That's a fascinating one. Tell me what you mean.
And the reason why I say that is because we're also, oftentimes, no, it's going to be okay. No, that's not that bad. No, it's all right. No, you don't know what you're talking about right now. Like, we get a lot of that, and we just shouldn't take that for an answer. You are in your skin. You know what's going on with you. And if you say, I just don't feel right, like something's going on with me because I really just don't feel right, you need to find the person who's going to be able to listen to you.
All right. So when you go to the OBGYN, pap smears, that's an annual, yeah? When do you start mammography? When do you start looking?
We usually counsel women to start at the age of 40.
Okay. That's dropped, that number has dropped a little bit. They raised it and then they dropped it again?
Yeah, so depending on who's the regulatory body, they may say that it's age 50 even to start doing mammograms.
Today.
But if you speak to the average OBGYN, they will
40.
still say 40.
Yeah.
Okay, in order to start mammograms. And then they may say you can come every 2 years, for example.
All right.
And it really depends also. It's important that women know their family history when it comes to things like mammograms, because that kind of can dictate when you need to have them, in terms of, do you need to go even sooner than 40, as an example.
Right.
As far as pap smears, I like to clear this up, because pap smears, everybody associates going to the OBGYN. Oh, I'm going to get my pap. There's so much more that should be happening at that visit, in the sense that that's the opportunity to have a conversation. Yeah. And if that means that you have that conversation and they say, okay, I know you have these issues that you'd like to address, I'm going to have you come back so that we can address this issue, and then have you come back so that we can address this issue. But the PAP itself is such a very specific test. Mm-hmm. And it's one that's not necessary every year.
Okay.
On average, we say you need a PAP every 3 years if your PAP history has been normal. So the PAP is not what's happening necessarily every year.
Right.
It's that check-in.
Right. This is interesting. That's different. My life is
My
different.
life is different. My
Yes.
period is different.
Something is going on.
My life is different. I no longer want to try to have a baby,
Right.
or my life is different and I'm trying to have a baby, which brings up one more point when we
Yeah.
talk about perimenopause and menopause is
So women
fertility.
are having children later.
Later.
So does that really impact the conscious choice of delaying having a child? You're seeing it's coinciding with perimenopause, and that's what, do you attribute that to where the fertility issues are coming from?
Well, I definitely think women are certainly having children later in life, accomplishing a lot of other goals first. But what I will say is the issue is that if they're not having the discussion with their doctors or their providers in their 30s, it's important that at 30 or even earlier that we stop and say, hey, I know you're on this trajectory, but do you know if you want to have children? Do you even know? Let's just stop and think about that for a second.
Do people have an answer for you when you ask that
Sometimes
question?
they do and sometimes they don't. And if they say, I'm not sure, I say, okay, that's all right if you don't know right now. But if you even think for a little bit that it might be something you want in the future, maybe we should be talking about some fertility sparing things such as egg freezing.
Right.
You know, and then the reality is that 30-year-old eggs are better than 40-year-old eggs. And because our fertility is such a consequence of our age.
Is your fertility also a consequence of your genetics?
I'd like to say yes. It's also another one of those kind of multifactorial things.
Yeah.
Lifestyle, of course,
Yeah.
and things like that. And also your partner. So they're
Right.
not out of this.
Nobody's alone in this.
They're not,
Right.
it takes two to tango.
Yeah.
Okay. But at the end of the day, just bringing it home back to perimenopause. Women in perimenopause are at the age also where they may be feeling like they want to start a family and then find that they're having some difficulty. And so if we have the conversation earlier regarding what perimenopause is, that it can happen as early as 10 years before you ever go through menopause. So if a woman who's going through menopause at 40, imagine she may have started her perimenopause at age 30.
Right.
Right? So she could have started experiencing symptoms,
Wow.
changes in her period, hot flashes, all kinds of things. And so if we just don't understand that part, you know, then we'll kind of a little bit behind the eight ball.
Okay.
Yeah.
Dr. Lubin, this has been a very interesting conversation. I really appreciate your time.
Yes.
Thank you very much. And thank you also to our audience today for being with us. We appreciate you, and we will see you again with another Riverside Talk.